The combined oral contraceptive pill, or COC, contains two hormones, estrogen and progesterone. Most brands of the pill contain the same type of estrogen, but the type of progesterone can vary between different makes. If taken correctly, the combined pill is more than 99% effective. However, we know that it can be difficult for people to take pills each day, and with typical use, it's about 91% effective. The combined pill works in 3 different ways. It stops your body from releasing an egg each month, it thins down the womb lining, and it also thickens the mucus at the neck of the womb to make it more difficult for sperm to be able to get through. The advantages of the pill are that it can help to control your periods by making them more regular and often lighter. Also, when you stop taking the pill, your fertility returns to its baseline very quickly after stopping. The downsides are that you have to remember to take it each day for it to be effective. It's also possible that you can get hormonal side effects, for example, changes in your skin, changes in your mood, breast tenderness, or sometimes some irregular bleeding, particularly when you first start it. But if you can keep going with it, often these will settle with time. It's thought that there may be a slight increase in the risk of breast or cervical cancer whilst you're taking the pill, but the risk of breast cancer comes back to your baseline with time after stopping the pill. And in fact, the pill reduces the risk of cancers of the womb, the ovary and the bowel. There is a small increase in the risk of blood clots whilst you're taking a combined pill. This risk, although is increased to people who are not on the pill, is still very small overall, and in fact is much lower than if you were to be pregnant. Many women are able to take the combined pill, but there are some medical conditions which we think it is not safe to prescribe this medication. When you see your doctor or nurse, they'll ask you a few simple questions about your past medical history, any medications that you're taking, and any conditions which run in your family. They will also check your height and weight and your blood pressure. They may also ask about smoking and if you have a history of anything like migraines. This is so that they can make sure that it's safe for you to have this medication, or otherwise they'll talk to you about alternative options. There are certain things which can make your pill less effective. For example, if you have vomiting or diarrhea, it can mean that your pill isn't absorbed so well. There are certain medications which can also reduce how effective your pill is. This can be prescribed medications or some medications which you can buy over the counter. So if you're starting on something new, speak with your doctor, nurse or pharmacist and they'll be able to give you some advice. There is more information on this on our website too. It's also worth remembering that the pill doesn't protect against sexually transmitted infections, and so you may need to use condoms as well.